Hi everyone, welcome back to the Navigate Credit Union Broadcast Center. I'm GoLocal News Editor Kate Nagel. Thanks for tuning in for the news and politics show today. After Laura Afonso had food and drink at 3 o'clock, I'd like to welcome the Director of the Rhode Island Department of Health, Dr. Nicole Alexander-Scott. Thank you for coming back to GoLocal.
Thanks for having me.
Well, I appreciate your taking the time to come in because there's a good opportunity, a great opportunity here in the state. Calls for proposals for building healthy and resilient communities. This is specifically reaching out to municipalities and nonprofits with some funding available, again, to further the department's Healthy Equity Zones initiative. So talk with us a little bit about this opportunity and who you're specifically reaching out to.
Absolutely. We're really excited to be able to continue this. It's our signature initiative that helps really emphasize our core belief that health equity means regardless of the zip code you live in, you have access to living the healthiest life you can live in the healthiest community you can live in. The way to be able to achieve that is really give the communities opportunity to make sure their voice is heard, to make sure they have the opportunity to organize, come together, build on the resources they have, and drive change, systems and policy improvements. That's a big part of what our Health Equity Zones initiative is about. We had a first cohort that was in place for 4 years, and that was successful. We have a Health Equity Zone all throughout the state. There are 9 total, 1 in every county. And we want to be able to expand that work and really make sure that communities can be heard, can really lead the way in making their environment livable. That's the broader understanding of health. We're not just talking about health care and what happens in the examination room. That only makes up 10% of what makes someone healthy. It's where you live, it's what you're eating, it's what school education opportunities you have, transportation, employment opportunities. Those are the goals that our Health Equity Zones initiative supports communities in focusing on. And we have a request for proposal that's out that allows for an additional $1.4 million in support to be available for communities to come together, organize, and think about creating some additional health equity zones so we can really build that support throughout the state.
So I know that the department provided examples of existing, as you said, from that first cohort. So let's talk about one in particular. The Harvest Kitchen Cafe in Pawtucket was one mentioned. So there you go, focusing on food there in the community. So talk a little bit maybe about that example.
Absolutely. It's really one of my favorite examples. The Pawtucket Central Falls Health Equity Zone has their collaborative and looked around the table to say, what resources do we have? What changes do we need? So they took the building that currently exists, where Harvest Kitchen now is, and renovated it using the partners that were already a part of the Health Equity Zone initiative. The Central Falls Community Development Corporation, LISC, the residents, so many others. And so on the upper levels of that building is actually low-income housing that's made available for people in the community. And on the lower level is Harvest Kitchen. And within Harvest Kitchen, there are locally grown, healthy foods, fruits and vegetables that are available for people in the community in a place where there are very few grocery stores previously. But then also, there's a jobs training opportunity to be a chef for youth who may be leaving from the training school there. And so we're really leveraging all of the resources to make things available that changes outcomes for the communities in Pawtucket and Central Falls. That's one example of many that health equity zones are looking to do throughout the state.
So let's talk a little bit more about the nuts and bolts of folks who might be putting in applications in this round for proposals for this funding. Municipalities, nonprofits, of course, will provide the links. But as you said, it's all-encompassing. Did they put a specific amount request when they put the proposal in?
They can. The first step is really looking around in the area and the community that you're in and seeing who can join the organizing, who can be a part of it. Each health equity zones has municipalities, residents, businesses, community-based organization, housing and planning, leadership, health systems, education systems. We want that to happen for the additional health equity zones. You can define what your zone is as long as it's a population of at least 5,000 or more, and see who's there that's committed to that area and wants to see change that's needed to make that area a better living condition, so we can really move towards that health equity goal that I said. Regardless of the zip code you're from, you have access to all of those important things: education, housing, quality transportation, and employment opportunities. So we want groups to organize and think through what their collaborative and their group would look like, what the defined area would be, and some of the key disparities that need to be worked on in that area. And reach out to us for questions. You can go to our website, health.ri.gov/RFP, and we'd be happy to support you. We really want to bring attention to this and make it an opportunity for communities' voices to be heard and to drive long-lasting transformational change.
And that last part that you bring up, as you said, you had a first cohort. I'm sure there have been deliverables, a number of people served in the community. But as you said, this is really looking at the long-term picture, because so much of this sounds like it's preventative health, enabling folks to live the healthiest, best lives that they can from all the number of factors. Do you think from the department's perspective that you'll see, and how long will it take to say, okay, these changes have really resulted in a lasting impact?
Absolutely. We're starting to see that with the first cohort. We know that it takes time, but it's really about building that capacity and the infrastructure at the community level, and then working towards changing systems and policies. So we have municipalities that are fully engaged. We have some residents in our Newport Health Equity Zone, for example, who've gone on to become council members and really help drive the change at that level. That's what's exciting about really making it so that it starts from the community and moves up from there and gets the attention of everyone across the state. This is what we need in our community to live well, and for our children to thrive, and for us to feel safe, and for everyone to be healthy. So that's really what we want to encourage as we move forward with this updated opportunity. And it's all about our partners. We're thankful to the funders in the state and nationally who are really paying attention to this and understand why it's critical, so that we can build healthy and resilient communities and make Rhode Island the healthiest state in the nation.
Now, I did see online that there was one deadline initially, a sort of a soft one, but really it's in March. That is, so this is the time that people can be getting their applications in.
Yes, the proposals are due March 26th. It's over the next couple of weeks that you're invited to submit a letter of intent, so we have an idea of how many people are out there. But it's really about then working towards a really strong proposal, getting all the partners together, getting that organization ready so that we can really drive those improvements that we want.
So I appreciate your coming in to really let the community know, again, municipalities, nonprofits working together in these, again, health equity zones. And we'll put all the links up as well for folks to see more about the application process. But I'll be up at the Rhode Island State House tomorrow. So while I have you here in the studio, don't want to kind of tack or put you on the spot, but from a political legislative perspective, as the Department of Health looks at what's taking place up at the General Assembly this year, could you encapsulate maybe what your goals are, especially legislatively? Obviously, we saw the budget proposal put forth by the governor, but what else you are looking to achieve from the Department of Health's perspective up on Smith Hill this year?
Absolutely. For us, it's all about building that community capacity, shifting investments where there may be too much in that healthcare setting. Some is needed, but that only makes up 10% of how healthy we are, and change it to that 80% that determines our health outcomes, where we live, what we eat, where we work, what opportunities we have. And so health equity zones is a major way to really support that key need of shifting investments and focusing on community. We also have a family home visiting focus with our budget that supports that effort of community. It allows community health workers who are family home visitors to be able to leave the healthcare setting and go into the home and engage with people at that community level. That has been shown to produce results. It's evidence-based, and we really want to be able to expand that so that we can support the communities and families that are in need. And being able to do that through our family home visiting program is a great way to do that. We also want to support our health care facilities that are out there and the opportunity to work with them to maintain the quality that's needed. That's a responsibility that we have as a department in working with them and having the resources to ensure that high quality care is something that we also want to raise attention to as important as well.
Well, I'm sure we're going to be, again, seeing the Department of Health up at the State House, but again, in the communities and letting the communities know about this, again, request for proposals for building healthy and resilient communities. And again, the deadline will be in March, but we'll provide those links as well. So, Dr. Nicole Alexander-Scott, I appreciate your taking the time and a very busy day to come in here. I'm trying to stay healthy, as you can hear here. And we look forward to having the opportunity to talk with you moving forward. So thank you for coming in.
Would love to come back.
Okay.
Thank you.
And thank you for watching today and this very, again, important piece of news out of the Department of Health. We'll be up at the Rhode Island State House tomorrow, and Chelsea Gay will be back here in studio in the Navigate Credit Union Broadcast Center with What's Cool. So in the meantime, check in with GoLocalProv.com and find us on Facebook. I'm GoLocal News Editor Kate Nagel.